mortality reduction.
సౌండ్ అట్లేదంటే
జాయిన్ ఆడియో అనుకుంటున్నా
ఏ జాయిన్ ఆడి
There are no intensivists who will be able to provide adequate care across even 10% of the country. So we need to do, and our chairman with his vision of reaching out to every single individual in the country started what is known as the EICU, which is the electronic platform using technology. An intensivist sitting anywhere in the world could actually treat and take care of a patient anywhere else in the world. Right now, we have about 1,000 patients whom are intensivists. You can see Dr. Sai Adinath sitting there. Behind him is the control room of the cockpit of the EICU, from where he's actually monitoring over 1,000 patients across the country, from most rural, most inaccessible areas, starting from Himachal to the mountains of the Himalayas, to everywhere in the country, and providing access to quality critical care. Now this is the beginning of a much bigger journey, and we are very happy that Professor Ravi Mahajan has joined us. He was the president of the British Society for Emergency Medicine, of anesthesiology. Correct me if I'm wrong, Professor Mahajan. And then he just joined us, and he's taken over the responsibility of standardizing and making sure that critical care in this part of the world is comparable to the best in the world. And it not only follows benchmarks, but creates benchmarks for the rest of the world. As of today, apart from 1,000 non-Apollo patients who are being monitored by this team, we have another 4,000 patients who are within our system in the critical care, and we have the largest ECMO. Today we have about 45 patients on the ECMO in the Apollo system. So we are now expanding these services, improving these services, embracing technology, and making sure that every single patient who needs critical care gets the best of critical care. And one last thing I wanted to say about the specialty of critical care at Apollo is the availability of multidisciplinary care. Critical care is not about a single physician or an intensivist providing care. It is about different specialties coming together for that particular individual and providing support and providing care, because majority of these patients tend to go into multi-organ failure and need expertise and skill to manage more than one organ in a critical situation. So I think the multidisciplinary care will not only be limited to the physical patients present in the hospital, but will be extended beyond the physical confines of an intensive care in the Apollo hospital onto the electronic platform using technology, using the EICU. So once again, ladies and gentlemen, welcome to this special event, and thank you for being here. Over to Professor Mahajan.
Thank you very much, Dr. Hari Prasad, for such a brilliant introduction and start to the program. So, as Dr. Hari Prasad mentioned, the Apollo hospitals and critical care go hand in hand, and that remains one of the strongest points of the Apollo network. So why do we need this center of excellence? that we are launching today. So if I can take you through what has already been said, 80% of the physicians in India work in urban areas, while 70% of the population resides in remote areas. So there is that challenge, hence there is work to do. The work to do is to provide smart solutions to the national shortage of experts, also to standardize, as Dr. Prasad quite eloquently mentioned, to standardize critical care throughout Apollo network and beyond, to partner with, add value to non-Apollo units, both public and private. And it's important that we are, or the Apollo are embracing the public as much as the private units for partnerships, and so that we have win-win-win for the patients, non-Apollo units, and the Apollo networks. So with those aims in mind, when we are looking for excellence and pursuing excellence and continuing to pursue excellence in critical care, this is what Center has determined to do in these and months and years to come. First is to oversee expansion of hubs and spokes network of Apollo units and non-Apollo units all over the country and beyond. We've got a very successful model working in Hyderabad. We want to extend it, and as we speak, we are working in Madurai and Chennai, and that should be, those centers or hubs should be coming along very, very soon, and then we will be expanding even further to the rest of the country. Second thing, of course, is that once you've got spokes and you've got hubs, you've got to support your spokes, and you've got to support those partners not just by providing the critical care to their patients, but also to upskill them or upskill people there and upscale the scope of the units. The standards of care, Dr. Prasad mentioned, very, very important. So the center will see to it that we have protocols and SOPs in place. And I have good news to give you that we've already got a live website today for the Center of Excellence in Critical Care, and that has a list of protocols and SOPs already available. The list is expanding day by day. We have partnered, of course, with Medversity, with Apollo Knowledge Series and Apollo Telehealth to provide the education to our spokes units, but also ongoing education to our own people in critical care. And this is a multidisciplinary and multi-professional educational platforms that we've got. Whether you are a doctor or a nurse or a paramedical healthcare employee, you will find something of use there. There's a rolling program that this center will be putting forward and will be conducting. Of course, nothing can improve without proper research and without proper quality indicators and measurement of quality indicators and quality improvement programs. So that is another big thing that we'll be doing. And for all of this, we are seeking international collaborations. We already have people who've expressed a lot of interest in many of these areas, whether it's to expand the network or to define standards of care or participation in education or research. It will be great to expand internationally, as Dr. Prasad already mentioned. I think the figures tell me, or my research tells me, that Apollo network of critical care beds would put Apollo at the top in the world in terms of critical care provision entity in corporate center. And that's my research. I may be wrong, but I think that is where we are. Therefore, we've got to consolidate that position and take it further in order to achieve our aims, which is providing international care, standard of care to every individual in India and beyond. Thank you very much for listening to me, and I think with that, setting the scene for the center and with the background that Dr. Prasad gave us, we are at right juncture to invite our Executive Vice Chairperson, Ms. Preetha Reddy. I can see her, she's joined us already. Ms. Reddy is such an ardent supporter for all the things that we do. And in particular, our vision for the critical care. And Ms. Reddy, if I could request you to please come in and let us have the overview or the vision of Apollo hospitals in terms of critical care. Thank you very much.
Namaste, our chairman, Dr. Mahajan, Hari, Dr. Sai, Professor Brokot, Dr. Allison. You know, it's just amazing to be among such wonderful clinicians, and I think maybe I'm the only non-doctor here again. So I wish I had been a doctor, but it has been incredible. The vision of our chairman, the fact, you know, what Hari said about what all it can do, and Dr. Mahajan on, you know, really putting the vision, taking it away from the drawing board and articulating it. I think it's amazing. The Apollo mission, actually, chairman articulated it almost 40 years ago, and it said that we will bring healthcare of international standards within the reach of every individual, and we are committed to education and research. The good thing about this mission statement and listening to all of you is that it is not within the reach of every individual in India, but it is for the region and really for the rest of the world. And when you all said international standards, I'm just listening to all of you, and I know there is a conviction in me that the international standards is going to be set by this team, out of India, out of, you know, the Apollo hospitals, and you will become a standard for the rest of the world to emulate. And to me, that is part of the strategic vision, that we as Indians, as very proud Indians, can really do something which the rest of the world will emulate. And I'll give you a simple example of what happened during COVID, that the district hospital in Chittoor, the outcomes were on par, if not better, than some of the global centers, because, you know, we were monitoring real time what is happening in India, what is happening in the rest of the world, developed countries, underdeveloped nations, and we saw that the outcomes there were on par, if not better, because early intervention, protocols which Dr. Hari has led the team implemented there, close monitoring and access to the drugs at the right time, whichever were best in class. So I think all this came together to give a product which is away from the metros, in the districts, in the, you know, rural India, and we could do it. Same thing is happening with, you know, telehealth. So I think launching this today is why we see that Apollo has 2,500 critical care beds. India has just, you know, 2.3 critical care beds for every 100,000 population, which is so not enough, not only for our country's needs. I think we will see transformative changes which is happening, and today's announcement is definitely a game changer. We are committed to raising the 2,500 beds to 10,000 within the Apollo ecosystem. But with today's launch, I think it will be doing much more than 10,000. It will be nice a year from today if we see the numbers which we can actually do. But to me, the sky is really not the limit. And the data which all of you are going to help us capture, utilize for the betterment of mankind, for the betterment of healthcare, I think that is going to be of great value. So tomorrow when we say education and research, we are really bringing the vision, the mission statement into actuality, and we're going to be able to really deliver on that promise. And that again is excites me, and I'm sure that, you know, I know Chairman so well, and once we say, Chairman, we're doing all this, he's putting 10 steps ahead and say, but you know, why not all that? So I would just say that, you know, I really thank the team, Hari, Dr. Mahajan, Dr. Sai, that whatever Chairman wanted, this is his near-term goal, and I can see that. But if we achieve on the near-term goal, then the foundation will be set for the long-term agenda and vision, and I know that we will be able to deliver on that promise. Thank you all. I'm just so excited to be part of this great institution, and I'm sure that we will really make a difference in people's lives. Namaste and all of us.
Thank you very much indeed, Rita, for such a wonderful support. We couldn't ask for any more, so brilliant. Thank you very much indeed for setting the scene up. I think we've, after the introduction by Dr. Hari Prasad and introduction to the center and the vision or the strategic vision for critical care by Ms. Preeta, the time is now right to invite Dr. Sai Haranath, who is Senior Critical Care Clinician in Hyderabad, for Sai to come in and demonstrate as to what does it really look like. I think to get that feel of something which is lively and you've got live situation in front of you. Sai, all yours. Thank you.
Thank you, Dr. Ravi. Thank you, Chairman, for being the vision behind this. Dr. Hari Prasad, Ms. Preeta, thank you all so much for this opportunity to actually allow us to grow in this ecosystem, to really do what only one other country really does. Other than America, there is no other tele-ICU other than our large system. What you can see is a live telecast, so I'm sure our media friends know that in a live telecast anything can happen. So we're actually in a live environment, we're monitoring patients around the country right now. You can see in the background one of my colleague doctors, Dr. Melito. Mr. Melito, you can say hello there, the screen there. And then we have our nurse also helping us with monitoring our patients. We are looking at centers around the country where we are critically ill patients who actually require assistance. Some of the assistance is simple, some of it is complex.